Welcome to the In Season podcast, rated R for language.
None of us are doctors or neurologists. Things you're about to hear are opinions of people living with epilepsy or seizures. These are firsthand experiences. Epilepsy can cause speech problems, and medications are hard to pronounce, so please bear with me. Epilepsy can cause bad memory, so some stories will be repeated. I'm Pookie. Get ready.
But I got something here, a new one. It says, any ideas? This is definitely a shot in the dark, but it isn't what Reddit, but isn't this what Reddit is for? 3 years ago, I had a grand mal seizure, and it hasn't happened until April this year, and it's happened 3 times before, over again. My neurologist doubts it's epilepsy, but my MRI was completely clear and my first EEG. I have another one coming up. I was also assuming, my first one was also assuming any ideas of a possible cause. I can answer questions in the comments and elaborate as much as necessary. I'm concerned because I haven't been able to drive because of this, and it's been so negative on my life. My neurologist thinks that this could be stress related, which seems to make sense. I'm under a lot of stress here. I'm thinking possible causes could be marijuana use, excessive energy drink consumption, lack of good sleep. Thank you for reading this. Please let me know what you think of it.
Has anybody else ever actually had an MRI diagnose a seizure? I always thought the MRIs were just to make sure you didn't have a tumor.
That's exactly what I was thinking.
I didn't know an MRI was looking for a tumor, so this is all new to me.
Unless maybe the MRI shows some kind of like scar tissue of some sort that the doctor says, upon reviewing these results, this could be from, or this looks like it's from like a lot of seizures or some, I don't know. That's the only thing that stood out to me on that one. But I can see the frustration, once you're diagnosed. And what was the question they actually asked in that post, actually?
Any ideas, basically, of what this is?
Oh, okay. Second opinion. Time for another doctor to go over all of your results and imaging and tests and give them your opinion.
I got 2 comments here. One says, I've been experiencing seizures for the last 5 months, and they're triggered by strong emotions, but startled. And I lose balance. I have inner ear damage. I'm currently in the process of excluding epilepsy as a cause. During my EEG, I seized during one of the strobing patterns. I suspect I have psychogenic seizures that are stress-induced. Another comment here says, having 2 or more unprovoked seizures is considered epilepsy. Many epilepsy patients have clean MRIs and EEGs. You might benefit from seeing an epileptologist or a neurologist that specializes in epilepsy. You are an anti-seizure medication. Oh, you're on an anti-seizure medication, right? Just a heads up, most epilepsy patients don't find a cause of their seizures. There are things you can do to minimize your seizure threshold, such as maintaining adequate sleep, managing stress, avoiding drugs and alcohol, and taking prescribed medications correctly.
I like that comment.
I did too. Syntaxcopry is a positive modulator of GABA. I don't know if GABA is something different because it says it's a capital GABA. Since Syntaxcopry is a positive modulator for GABA, you think theoretically it would help anxiety. Does anyone here have any real-world experience of Xcopri helping with anxiety or panic disorders?
GABA is gamma aminobutyric acid. It is the neurotransmitter in the brain that is the primary down-regulating neurotransmitter. So it's kind of like an opposite to dopamine, sort of. It's yeah, it's the receptor that most sedative hypnotic drugs act upon to exert um, their sedating effect. So
I'll go to some comments since I never
Being
took it.
the one that's actually on Oxcopri, I don't think it's a. If you wanted to treat your anxiety, no, it will. It will put you to sleep. That's what it will do. Like Mark said.
One comment says, "I'm nervous about Xcopri as it is a narcotic and has the ability of abuse. Been clean more than 12 years and wouldn't do anything to put that on the line." Another comment says, "I think it indirectly increases my anxiety, primary from the fatigue and mental cloudiness, and then the anxiety about how that's going to affect my life and career." Another one says, "Thank you. Still though, it makes me nervous as well as the possibility of depression and SI, which I've been highly prone to. And with me being deemed drug resistant, it seems like a silly thing to try." Angel, you say trying Xcopri is good for sleep?
Yeah, it its main side effect. When they like when you read the list of side effects, usually when you try new drugs, they usually say drowsiness. Xcopri says sleep.
It doesn't make
Andrea?
you drowsy. It puts you in a coma.
Yeah, and
It's
mixing it with
yeah,
mix,
I call it my Xcopri coma.
yeah, mixing it with benzos. Oh yeah, you're gonna be out for a while, long time.
That is good to know. Xcopri, you said it's a benzo?
No, it's not a benzo, but it is a narc. A strong. It's a Schedule 5
A
drug. So
I didn't even know there was Schedule 5. Is it an
yeah,
anticonvulsant?
Yeah, it's a pain in the ass to get.
I'm a nurse and
Uh,
I didn't even know there was such a thing as a Schedule 5.
yeah.
I don't
yeah.
know what that is, but I know it's a pain in the ass to get.
Like benzos are Schedule 4. Xcopri is harder than that.
that might just be because it's so much newer than most of the other medications that it's uh like
That's a good point.
competing against.
That could
Yeah.
be.
Yeah, it is a strong one though. Yeah, I think when I was researching all the stuff on Xcopri, it was released in 2019. So yeah, it is newer to a lot of stuff. But like
Speaking of which, I need to go get my meds right now, so I'll be right back.
me and my neuros had like 3 hours before we even like when they were prescribing it to me, and it took like a few weeks for it to get to me, and like a week longer just to get approved by my health insurance. That was back in May. And I was taking that with Clonopin at the same time, and it was killing me.
Something here, it says Schedule 5 drugs are classified as having the lowest potential for abuse among controlled substances and are commonly used for medical purposes such as treating cough, diarrhea, or mild pain. Definition and characteristics: Schedule 5 drugs are substances that have low potential for abuse. Relative to drugs in higher schedules, they are recognized for their acceptance, medical uses, and treatment with the United States. Abuse of these drugs may lead to limited physical or psychological dependence compared to substances in Schedule 4.
I bother scheduling it, then that just doesn't make sense.
I remember them telling me it's like it's the abuse of it. It's easier to like you know um the addiction part, and it's all like think of it like an opiate or something like that, but I don't think it's an opiate. I don't. I wish I kept all the notes right here with me when I was researching it.
So you
I
don't know if
believe that.
Excopri is an opiate?
Yeah, I don't think it is a narcotic, but I don't think it's under the opiate.
It doesn't say anything about being an opiate.
Yeah.
And it says Excopri is an anti-epileptic medication used to treat partial onset seizures with adults. It works by affecting sodium and GABA channels in the brain to reduce the number of seizures. Excopri is taken as a once daily tablet.
One of the big side effects that Anne actually went through was the increase of the heart rate that it does. And me and her were getting on it around the same time. And I remember to look out for that when it does that. It's like, hurry up and get off of it. It feels like a heart attack or something, like it's quickening your heart rate way too fast. And then there was the one that the doctors really warned me about was a bad rash that if you develop it, just stop taking it right away. Those are the ones I remember. I'm trying to remember every little thing. I know it was like a 3-hour appointment I had with them.
Someone told me they don't take lamotrigine like myself because they get a rash. Has any medication caused you to get a rash?
None.
Yeah, lamotrigine gave me a sun-sensitive rash, but it wasn't Stevens-Johnson syndrome. It wasn't the one that sends you to the ER. It was just anywhere the sun touched my skin for like 20 minutes or more, I get these red bumps and stuff. It just sucked. Having to wear long sleeves in Florida and
Oh
no,
man, I forgot about that.
yeah, that
I
in the
can
middle of
imagine
the
that Florida
summer.
weather. You can't get short sleeves. I do have something here, you guys. It says, "Has anyone's medication just stopped helping them? I've been taking lamotrigine for 6 years, and I'm currently taking 300 milligrams. My neurologist has been increasing my dose by 25 milligrams twice a year. At this point, I'm basically backing seizures. I'm basically back to having seizures as frequently as I did before I started taking it. Initially, it did help a lot, but I'm wondering if maybe I just need to up the dose more quickly. It seems like 25 milligrams increase just doesn't do enough for me. I know there are a lot of concerns with upping the medication quickly because of SJS. I'm feeling pretty discouraged at this point." The question was, has anyone's medication stopped helping them?
What's the SJS?
SJS is.
Stevens-Johnson's.
Say that again.
Stevens-Johnson syndrome. It's what Mark was referring to. It's that really bad skin rash. It can be fatal.
Isn't it like an immune system reaction or like overreaction or something?
Yeah, I think so. It's a lot of medications can cause it. It's basically just like a terrible allergic reaction to a medication. Um, but I was on lamotrigine is Lamictal, right?
Yes.
Yeah, I was on Lamictal for years, and it kind of I felt like it kind of stopped working for me. Um, so I just switched medications because I was on a really high dose, and I also hated the way that it made me feel. Like just it felt like I was just walking through life in a cloud. Just the brain fog was insane. Um,
Yeah.
it was awful, and I hated it. And but it's I'm it. I felt so stupid because I never uh considered just asking my doctor if I could switch medications. And then one day, um, I just broke down just telling my doctor how much I hated it. And he was like, "Oh, we'll just put you on a different one." And I thought, "Oh, I didn't even think about that. Yes, please, let's do that." So that's what I did.
They had the last time I was on Lamictal, lamotrigine. It it was while I was taking it with Keppra, and it was supposed to be the offset of the rage, and it wasn't controlling the seizures, and the anger was still coming. So yeah, it wasn't working. But yeah, I am medical resistant, so but I did feel that fog. I understand what you're saying about that fog.
I got a few comments here. Um, along with you saying that you had a few things that the lamotrigine caused, I've been on lamotrigine for almost 10 years, and it's actually been the best thing of the three things that I've tried. Um, it's worked pretty well for me. It's like I said, it's been the best of the three that I've tried in the past 20 years. So, um, yeah. And I think I'm gonna add something to it. Well, not I think, gonna add Omvi to it. Um, how long were you on lamotrigine or lamictal?
I've been on it twice in my life. One time when I was younger, and they took it off. They took me off of it. I didn't question why. I was just doing what the doctor says. Um, when they put me on Depakote. And
Solace, what about you? Oh, go ahead, Angel.
then again, they put me again on it when I got on Keppra, and that was a few years,
Okay.
and it wasn't working.
Solace, what were you saying about lamotrigine? I was saying that it was the best thing that's worked for me, and you said it didn't do you any good. I was asking how long were you on it?
Yeah, I'm trying to think. Um, they first put me on Keppra. I wasn't on that. I don't even think I was on Keppra for a year because it just made me like psychotic, basically. Then I switched to Lamictal, and I guess I was on Lamictal for, I mean, it was several years, um, at least 5 years, but maybe more. Because I've been on zonisamide, I don't know, maybe closer to 10 years, really. I can't remember. I can't remember anything. But that's another thing about Lamictal is my memory was worse when I was on Lamictal. I really think it was. Um, it's my memory still feels bad, but it's not as bad as when I was on Lamictal.
Do you feel
Well,
like your memory gets worse and worse through different medications, or do you feel like it's getting worse and worse throughout the epilepsy journey, or the medications in particular cause worse and worse memory?
I think it's related to the medications because I mean, I haven't had that many seizures like in life. The seizures I have had, they're all really, really big ones, really bad. I've almost died uh 2 times from a seizure. Like so I haven't had that many seizures, but the ones I do have, they're really bad. Um so but I really think the cognitive effects that I have, I truly think it's from the medications, not the seizures. But I could be wrong.
I feel the same.
I think it's half and half.
Yeah, it could be that too. I mean, it's hard to tell, and it's also kind of like, you know, it's frustrating, but it's like it doesn't really matter if it's from the seizures or for the medication, from the meds. It is what it is, and it's just something that um, I have to deal with. One weird thing that I feel like is definitely from the medications is like sometimes I do this weird stuttering thing, and that did not start until I got on zonisamide. It's like it's not some people have trouble like finding words, but I do this weird thing where like I'll start talking and it's like I'll I'll do like this weird stutter thing or I'll like fumble my words. Um and that's embarrassing. That's like probably my least favorite side effect because I didn't used to do that.
Gotcha. Yeah, I could see that being very stressful side effect.
Hmm.
Stuttering after starting a medication. Uh, I do have a couple more comments here that I didn't get into. One says, can definitely happen. They'll make it work for me with periodic increases for about 12 years, and then it stopped controlling seizures about 5 years ago. I had to switch to Keppra, hated it for 2 years, and now I'm much happier on Briviac. My neuro described it that the meds issue in a really helpful way, in quote, brains are really good at learning. It's what they're designed for. Your brain found a pathway to circumvent the lamictal's control, and now it's finding that same pathway to more easily, and it will continue to do so unless we switch meds. As someone with a learning science background, this really resonated with me. Another comment says, absolutely. I'm no longer on that med. Another comment, up the dose, add another med, or change the med. People's seizures, tolerance, and thresholds can change over time. This method could not be as effective anymore or needed at a higher dose. It's not uncommon for people to, end quote, grow out of medication where it is no longer prevents them from, but another med does. It might be worth it to talk to your doctor if changing meds or adding a med isn't, instead of increasing the dose, maybe more effective for you. I noticed that with taking my medication, sometimes my words get jumbled a lot. And yeah, I didn't get the stuttering, but I do jumble up my words here and there.
And forgetting what you wanting to say, forgetting the exact word or whatever.
Yeah, I could forget what I'm saying as I'm saying it, as I talking and forget what I'm talking about, which is
Yeah,
bad.
I
But
remember having to trying to describe a word that it was like an argument I had with my ex-wife, and it was just like I'm trying to describe a word and I don't even like I know the word and I can't figure it out. I had to like show her the phone like this is what I'm doing, and like the word was now I'm forgetting it. The depreciating myself. You know? Like I was in one of those depressed feelings and devaluing myself. And she thought I was talking about her, and I'm like, no, I'm.
I understand. Yeah. Um, is anybody on Kepra here?
Not
I am
anymore.
not. I'll read this post anyway.
Okay.
It says I just got prescribed with 2,000 milligrams of Keppra per day. Just have a few questions here. Anyone else have it? Anyone else have it? I believe it is focal or clonic tonic seizures. At least that's what the doctors have said. But where your left arm completely locks up and then stiffens and can't even control it, then you pass out or have a seizure. The doctors haven't figured out what causes that yet. All they say is that something with the right side of my brain isn't right. I've been looking more and I'm starting to think it's damaged with my it's damaged nerve in my arm. I'm wondering if anyone here has the same problem and what they found out. Also, for those on Keppra, I got off Keppra. How long was it that they have you fully off meds? I'm very curious if this is what happens long term with meds or just a year or so. Um, there's a lot of questions in that one
Yeah.
question.
Yeah, what is their uh
Yeah.
I don't so what they mentioned about there being a problem with a nerve in their arm, as far as I know, I don't know of anything of how that's related to epilepsy. Like just they mentioned like their left arm, something about their left arm. Uh
Mm-hmm.
that
Left
was
arm completely locks up and stiffens up. You can't even control it. Then you pass out and have a seizure.
I guess
The
maybe
only way
they could be
I
referring
can
to a myoclonic jerk, possibly. I don't know.
probably, or maybe they had an injury or something that's basically constantly stressing their body or their mind. Like they
Right.
might not consider themselves stressed out, but their body is actually overstressed because of it, stressing out.
Mm-hmm.
Um, and it's causing them to seize more.
So are they
Um,
still on Kepra or are they off of it now? Like, are they asking?
Um, no, I think they said they got off of it. Yeah, that's what it said. I'm off of it now.
And it seems like they're
Uh,
asking like what the long-term side effects or long-term effects after you get off of it are, but they didn't really mention what was happening to them. But I don't know the answer to that.
no, it's hard to say what the long term side effects are because some of us been on. I've been on 12 plus drugs in my life for seizures, and it's hard to say which one is from which I'm still experiencing. I can
Yeah.
say the rage and stuff definitely went away fast after I got off of the irritability, whatever, went away after I got off of Keppra. But it's very hard.
The only comment here is a pretty long one. It says, I don't have focal, have been diagnosed with clonic tonic seizures as well as epilepsy. My arms don't lock up before a seizure. To be honest, rarely do I have anything ever happen before just starting to have a seizure. If something does happen, it's sometimes me heavy vomiting, sometimes me already losing consciousness but still being able to say, in quote, I feel weird, or in quote, I need to sit down, but not remembering anything at that point, and mostly often me smacking my lips and staring blankly. Then I usually fall to the ground, and if I'm not sitting on the floor, and if I'm not sitting and starting to convulse. I was prescribed Keppra, but after 3.5 months, 3.5-ish months, if I'm not doing anything to help or stop lower the amount of seizures I was having, I was put on something else. I have been told for me, it'll probably be a long life, long prescriptions. At the end of the day, at the end of April, I was prescribed the second anti-seizure medication because I was in the hospital recovering from a really bad one where I cracked a left orbital bone falling into a doorknob and broke
Oh
my
God.
upper right humerus into 15 plus pieces while continuously convulsing, while it, in a weird way, angled against my dresser. Needed a seizure, needed surgery to put in 2 metal plates, 7 screws, 3 nails. At that point, I was already on a, end quote, above the recommended dose of anti-seizure medication, lamotrigine. A small dosage of lacosamide is what got added. I was having at least 3 to 4 seizures a day for 7-ish months before I started taking lamotrigine and dropped it to about 4 to 5 a week. The increasing dosage has dropped it to about 1 to 2 a week, and haven't seen anything really happen since an additional lacosamide, but hopefully an increase of dosage will help drop the amount down. And that is the only comment.
I feel like does that even answer any part of the
Not at all. Anybody here taking oxycarbazepine?
I've taken that before.
Okay, this one says differing effects of oxycarbazepine, 300 milligrams, based on different pharmacies. I have been taking oxycarbazepine for years, and I had to switch pharmacies to CVS because my old one closed. I noticed a significant difference in how the meds made me feel, like dizzy and woozy. Switched to Kaiser's pharmacy because I got insurance through there from work, and those more intense effects went away. When I lost my insurance just recently, just switched back to CVS, same thing on the switchback. Has anyone else ever had experienced something like this?
I don't, not with oxcarbazepine, but I take an antidepressant, and my psychiatrist, uh, he only wants me to get it from a certain manufacturer. Like I go to a certain pharmacy to get the medication, like so I know it's coming from a specific manufacturer because my psychiatrist said certain drug manufacturers are, depending on certain medications, they are better than others, and especially with antidepressants. So if you have, like, I take Prestige. So Prestige from one manufacturer at a certain dose is not the same as Prestique in the same dose from a different manufacturer. And there are a lot of studies on that. So it's likely it was from a different manufacturer and it was formulated just ever so slightly different. And it could, have a different effect. But a lot of people say, I've heard people say that's not true, but I believe that it's true.
I'm gonna go
No,
with
I
you. I
believe
believe
it's true. It's the same as uh like generic versus um the brand name,
yeah.
It's like you can get one that's more potent and one that's less potent.
Right. Mark, I
Uh,
almost bought a lava lamp the other night.
oh, really?
Yeah, they had some at Target, and I thought of you, but I couldn't decide what color I wanted.
That was going to be my question. What color combo were you looking at?
Yeah,
Okay.
they had an orange one that I liked a lot and a blue one. But I
Orange,
could
like orange wax, or
So that's the thing. I couldn't tell. I couldn't all I knew was the wax color. I didn't know. I guess it's the light that creates the other color.
the fluid.
Oh, the
The
fluid. Okay.
yeah.
I couldn't
Um,
tell like how I was like I know they're two colors, but I don't know. I could only tell what one color was from them. Um,
I don't know if it's can sort of see me through the bottle there.
yeah.
Yeah, this one is just a clear with this was probably a poor choice. It's like a dark blue, so it looks kind of black wax, and the fluid is just a clear, like clear water.
Yeah.
This one is oh, now without the light underneath, the wax doesn't show up, but this one is orange wax with um a blue fluid.
Oh, okay.
So
Yeah, maybe they were just clear, the ones I was looking at, clear fluid. But I want one that's got colored fluid.
yeah, some like this one, or this might be a better choice.
Oh, yeah, I like that one.
Yeah, this is the orange wax and the purple fluid.
Yeah, I like that a lot.
That's kind of a good representation. That one is, I think, probably one of my favorite like color combos. The orange with the purple. Or sorry, that's yellow wax, purple fluid. Because the yellow and the purple like shining through the purple makes the yellow look more and more orange the higher it gets.
Oh,
So like by the time it gets up to the top with one of the bigger ones like this guy, um, well, probably shouldn't move that one around too much. That one I actually just got on Amazon like a week or two ago. That's this 16.3 inch tall. So the 52-ounce globe. So it's the bigger one. These are smaller. They're only a 20 ounce.
hmm
So it's like the size of a soda bottle. Um,
yeah.
but the other ones, the a much bigger globe has a lot more room for them to kind of move around sideways and stuff. So I, um, I mean, just based on what I've seen on Amazon, the price difference between the 52 and the 20-ounce globes really If I were to shop and get another globe, I would probably go and try to find the bigger one. Okay, so I'd try to find the bigger one. Yeah, just because the zigzaggy and lateral, when one is coming down from up above and then bump into one coming from below, you have to, I don't know, it's easy to get lost in that kind of stuff,
Yeah. Yeah, the ones at Target, they were $25. I don't know exactly what size they were, but I thought that was I would have thought they would be more expensive than that. I was so close to buying one, but maybe I'll look on Amazon.
Yeah, I mean, for $25, that's probably one of the smaller ones.
Yeah.
But yeah, I have found the best luck in terms of the quality of the globes. Sometimes the water can get really cloudy, and the Lava brand has a partnership with Spencer Gifts, and they have a lot of unique color combinations and different like special themed lamps. And it seems like they have higher quality control, quality assurance with those
Yeah.
than they do with the ones that they kind of send out like a wider mass market. And maybe some of that has to do with the various retailers handling and stuff, Walmart
Yeah.
and Target. Retail employees might not care as much. Yeah. Just in time for Pookie to return. We talked about nothing but lava lamps.
I'm here.
Yeah.
Here for it all. Yeah, I was listening.
You gotta get one too, Pookie.
I'm starting from scratch, as you see. I don't have my game chair. I don't have my desk. So I'm starting my whole. Yeah, man. You remember the last time I had my setup? Post stroke, I gave up everything, and you can't exactly move those. Well, I can. Can't exactly take those things and be like, hey, can I move this basically studio into your bedroom? But I do have something here, you guys. It says, did I have a seizure? I was on my phone watching a TikTok, and I'm assuming. I can't remember what time it was, but then suddenly I just woke up with no memory of what happened in the past couple hours and no idea if I passed out or had a stroke or a seizure or something. I'm so stressed, it's hard to type, so I keep slurring my words as well. I'm also withdrawing from alcohol and benzos. Sorry if this was worded badly. I'm finding it hard to type. That's the end of
Wait,
that. But the question was, did I have a seizure?
my
Go
question
ahead.
is, did they have a stroke? They said they're slurring their words. What else did they say?
Yeah, I was gonna say that. Slurring their words, woke up with no memory, yeah, passed out and stuff like that. And
Withdrawing too.
yeah, they also said they're withdrawing from alcohol and benzos. So
Withdrawing from benzos will most likely definitely give you a seizure.
Right.
Yeah.
Well, alcohol, both of them, they're both dangerous to get off of.
I mean, I wouldn't know personally. I did a
The
cold
slurring
turkey.
of the
I
slurring
know
of the words.
100% from experience.
slurring of the words, that's weird to me because that doesn't really fit with, that sounds more like a stroke to me, but they
Yeah.
didn't really say anything else that sounds like a stroke. So I don't know. They need to go to the doctor, basically.
Go see a doctor, and don't let them tell you that you had a seizure if you think that something else happened, because I had a stroke, and you can't just let them tell you whatever happened, because sometimes they will tell you what they want to hear happen, or I don't know what they felt like happened. But I was in the hospital 4 days before they finally figured out it was a stroke. And
Mm.
I told them that for 4 days because I remembered the whole thing. I never passed out or anything. Um, if you weren't here, I'm not sure who I told the story to, but
I
when I
wasn't
passed
here.
out, when I did, oh, I didn't pass out. I kept like telling myself, this is a weird feeling. I don't understand what the feeling is. And I was just like, let's lay in the middle of my bed as I usually did. That was a great bed I was in before I moved here. Yeah, I was like, let me get in the middle of the bed. Usually surround myself with the pillows and all that. And then I'm lying there and I'm like, what's going on? I'm not having a seizure. Usually a seizure's coming. This is a really odd feeling. And then I started to get nauseous. And then I'm like, why am I nauseous? Just like out of nowhere. This is kind of a really, really odd feeling now. And I was just like, I'll just not throw up on the bed. Let me just throw up on the floor. And when I tried to get up is when I noticed that my left side was kind of just like close to me and I wasn't able to use it. So I'm like, okay, since this isn't a seizure, um, I know what this is. Luckily, us having seizures, well, not luckily, but luckily knowing what a seizure is and having seizures before, I knew that I was not having a seizure. And I kept telling the doctors for days that this isn't a seizure. I think I had a stroke. We should check for a stroke. They kept telling me, well, your sister said that you had a seizure and you have epilepsy, so it makes sense to do an epilepsy check and not a stroke check. Yeah, so I didn't listen to them, and luckily I didn't listen to them, and I went to another hospital after that, and they told me you had a stroke. They were able to tell me that the first day, and yeah, Stanford's a great
Wow.
hospital. So
What kind of stroke did you have, if you don't mind me asking?
oh man.
Was it
So,
an ischemic?
no, it's a hemo something. Hemo forgot the
A
name.
hemorrhagic stroke?
There you go. Um yeah. And then I asked why, and they said they weren't 100% sure of the reason. And they did ask me, or you know that you're more at risk for a stroke when you have epilepsy? And I told them, no, I did not know that. They did not let me know that that was actually a reason we could have a stroke. And yeah, hemorrhagic stroke is what they called it. And yeah,
Hmm.
yeah, the first hospital, they weren't trying to tell me that I had, well, no, they didn't know because they weren't looking for a stroke. So the fourth day, when they finally were looking for, I don't know, because one day they did it and they're like, okay, we're going to send this to your doctor and we'll get you out of here today. And then later on that night, they're like, okay, we didn't send the results over to the doctor, so they'll see you in the morning. I see the doctor in the morning. He's like, okay, we're going to get you out of here. They said you've been here 4 days or whatever the case. And I'm like, okay, I just need to get out of here and I'm going to go do what I need to do in another hospital. I woke up maybe like 45 minutes to an hour later. I looked around. I laid back down, watched TV for a little bit. Then my mom called me and she was crying. And I'm like, what's going on? And she's like, you have a stroke. And I'm like, today? Is that what they're telling you? And she's like, no, that's the whole reason you're there. Everything that happened was because of a stroke. And I told my mom, I know what happened. I told her, I know exactly what happened. I knew that happened. And I told them over and over and over. And they just, yeah, they didn't even come let me know it was a stroke because they know I'd been telling them all day and morning and days before that it was a stroke. I'm
But
not
they
sure if
told your
that's
mom?
malpractice or what, but
Wow.
Um,
So how did your mom know?
they didn't tell me. They decided to call her instead of telling me because I had been telling them all day and the days before that this was a stroke. This was a stroke.
Yeah.
So I guess they were too cowardish to come tell me. So they told my mom, and she called me crying, saying that I had a stroke. And I told her they could have told me that because I would have told them, I told you so in their faces. And they did not tell me that. The hospital still to date has never told me that you had a stroke. My mother called me, and then we just start working on a stroke. They never told me you had a stroke. That's why you're here. Yeah.
Wow, Pookie.
Yeah. So I was off the podcast for 5 weeks for them telling me that I had a stroke. I mean, that was more than 5 weeks. That was, yeah, that was the 5th of last month to now. So yeah, I've been
Did you
gone over a month.
did you have to go to rehab or like do you have any like residual weakness or anything?
I can't feel the sensation in my, can't feel my right 3 toes, and some of my right side along my arm, along my back, um, some of my arm right here, some of my side, a lot of my right side, I'll say. The left side, I can feel it, but as I explained to other people, it's like it's like a meat sack. That's a weird way to explain it, but it's like I can feel that it's there, but I
Hmm.
can't feel it if I was to take a little needle and do that with it.
Yeah.
I can
Yeah.
feel when I step because I'm standing on it, um, but I can't exactly feel when I'm like swinging my leg if my foot's there until I put it on the ground. Then I'm noticing I'm standing on something.
Hmm.
So that's what I went through, and yeah, and for 5 days they didn't bathe me or anything. Um, the
Oh my
nurse that they
God.
told me could not bathe me. They told her that she could just rinse me because I had seizures, so they didn't want to give her um they didn't want to give her scissors or a shave or anything because they let me sit in that shit for 5 days. So yeah. Then I got out of that hospital and I went to another hospital. And Stanford, they did everything I knew they were going to do day one. Told them what happened, and I went from the emergency room to the stroke department same day and got everything figured out first day. And they
Wow.
left me, they had me there to recoup and everything, and Stanford did great for me. Um, but yeah, I got a malpractice suit on my hands. I'm not sure if that's what that is, but yeah, like I said,
It
I told them that, and yeah,
it could
but
be. I'm sorry that happened. It sounds terrible.
it's all right. It's the world. It's people these days.
Yeah.
Um, yeah, I think mostly they're just going off what they knew off paperwork. They didn't know anything else because I was in the emergency room, so they didn't have a neurologist to say this and this happened. They had someone to come in and said it sounds like this happened and it sounds like this happened, and they kept saying what it sounded like. And someone said you had a seizure, and they stopped listening to me when I said, I have a podcast on seizures. I know what a seizure is. Once I said that, they just looked at me like some podcaster. It's like, yeah, he keeps saying that stuff about a podcast. Yeah, I think they didn't want to hear me after I said I do a podcast on seizures, and they didn't want to hear anything else I had to say. They didn't hear me out at all. So,
Yeah,
hey,
I mean, fortunately, sometimes, I mean, I'm a nurse. Both my parents are healthcare providers, and even I know that sometimes if you want to get decent care, sometimes you just have to be a straight up bitch. I mean, that's been my experience. Like if I and I like there have been times when I needed to go to the emergency room and I don't because I know that the minute they hear I have to be treated like a psych patient, possibly get admitted to the psych floor, and then I'll get stuck there, Like going to the ER when you have epilepsy is for me terrifying. Because people just treat me like I'm crazy. Um, and but just in general, if you decent care anywhere, I kind of just have to be like really aggressive, which is crazy, but that's the truth.
Yeah. I've been to psych wards. Oh,
How'd that go for
and
you?
no, I do not ever want to be there again. They didn't even have. I was on one of the 4 medications I was on at the time was Briviac, and they didn't even have it in stock. And I was like, "You're gonna have me go into a seizure?" And it was like, "Look, I brought all my medications with me. It's like, here, just go get it out of my bag." It's like,
Yeah, I don't know.
yeah, they
I don't
treat you
know.
like you're crazy, and
Yeah, I mean, I don't know anyone who's ever been admitted to a psychiatric floor and then been discharged and said, yeah, that helped me. That was a good experience. I'm glad I did that. It's always,
mm,
that was terrible. I feel, like dehumanized and just awful. Um,
yeah,
so, and a lot of times people,
it's like
unfortunately,
mindless.
yeah, and people, a lot of doctors look at people with epilepsy like this is a psych patient, and sometimes people with epilepsy are psych patients, but sometimes they're not. Um, and if you go to the emergency room and you have epilepsy, and depending on where you live, it's not that hard to just get admitted to the psych floor because they don't know what else to do with you because they don't have, like you said, that a lot of times they don't have a neurologist,
Where
standing
they,
around.
they don't want to treat, the right way.
Right.
I've been in the psych ward, and it was not fun. And uh, I woke up there. They said that I had said I was gonna jump off the second story balcony. Um, that doesn't sound like me at all. So I woke up in the psych ward. They didn't believe that I didn't remember any of what happened. So I say that was a seizure because I didn't remember not one part bit. I don't remember the ride there or anything. I remember waking up, being handcuffed to a chair,
Oh
wondering what's
God.
going on. And there's just people that were connected chairs, maybe 6 feet in between me. It's like space in between us. And everyone, well, not everyone, most people were screaming. Most people were screaming at other people to stop screaming. And then there was those people who were screaming, unsure why. There was the people who screaming because they're probably withdrawing or some of other things. And then there's the people that are screaming out those people to stop screaming. So it's just a room full of people just screaming at each other. And there's one person watching us, but I think that's all that person is there to do is just basically watch us because we're all cuffed to a chair. So it's like one guy behind a glass, and if I yell at him to can I go to the bathroom or something's happening or anything, the person's behind a glass and you can just wave at them and hope they come out, and none of that usually happens. Luckily I didn't see anybody have to ask to go to the bathroom. But the time I was there, I didn't have to go to the bathroom, and they just had us sitting there in a room. And then eventually they came and got me, and someone came and picked me up. But yeah, they will put you on a psych ward because whatever happens during a seizure. And luckily,
And
eventually, someone heard me out. Their doctor that was there was like, "Okay, yeah, that sounds like a seizure," and not any of it. And they was like, "You don't use drugs. Check my system." No, you don't. Okay, something else is going wrong if you don't remember this. All right, well, I can go.
yeah,
Um,
everything is prescribed. I have prescription for all these.
They
I
thought
don't
I was
take
on
it.
drugs. They I forgot the situation that had happened or whatever. It threatened my mother that I would commit suicide. So I don't even know why they thought that was a thing, like even possible. Because I mean, I love my mother, and I wouldn't like threaten to commit suicide. Like, you better do this, or I'm gonna. That kind of doesn't make sense to me, but I guess it happened to other people. Um, yeah, that's not something I would do, and yeah, I want to be here. I don't know any other reason, but yeah, I have family and people to live for. So
And then the
Yeah.
ER trips after that is always, I want to hurry up and get out of here. I want to escape. And
right.
Pookie, you're my hero. You actually escaped one time.
Oh yeah, I escaped the hospital now. Yeah, that was different. That was anger, and I think that was a seizure sitting in there by myself. When I put all the pieces back together from back then, I just remember myself getting really angry and leaving. So I think that was probably having a seizure, maybe like the impending doom seizure. And I'm just confused and not sure what's going on. And I just decided, let's take this IV out and let's go. And I did that. So
Yeah, I come out of a seizure
at all.
and I'm seeing myself in an emergency room and I don't see nobody that's like basically either, well, back then, like, it would have been my wife, or now it's like my mom or sister. It's like, yeah, I'm trying to hurry up and get out of here.
Yeah. Same.
Yeah, I tried to. Oh no, I did. I kicked open the door to the ambulance once, so I've done that. But the time I escaped the hospital, yeah, they sent the police to my house. Police made there before me, so I never even seen them. I was just told when I got home, where you been? Police were looking for you and this and that. And they never came back to the house. But yeah, so I'm assuming the hospital they sent the not assuming the hospital sent the police to my house, and they hadn't known how long I'd been gone from the hospital because I think when I got home, my cousins and stuff, they were like, "Oh yeah, they came here about 30 to 45 minutes ago," and it was like an hour and a half walk home from the hospital. So I did that
Wait,
with the
why did the police go to your house? Like, what were they gonna do?
no idea. Um, Probably arrest me.
Because like,
Um,
but why though? Because I mean, you're allowed, anyone can just like walk out of the hospital if they want to. Unless you're on a psychiatric floor. Like if you just want to walk out of the hospital and leave, you're allowed to do that.
I was in a hospital bed though too. I wasn't just like in the hospital. I was in the bed with an
Yeah,
IV, and um,
yeah.
I don't
But
know why
even
the
so,
hospital, why the police came in particular. I don't know.
yeah, that's weird. Maybe because if you do leave the hospital, technically you're supposed to sign paperwork saying like, "Hey, I'm leaving against medical advice." It's called leaving AMA. So maybe that's why if you didn't sign paperwork saying like, "I'm leaving and I'm, refusing treatment or whatever." But I don't know. Because I um yeah, people leave the hospital all the time. I've seen someone leave the hospital with their IV pole, like steal an IV pole, walk out with a hospital gown, and just like head out down the street. Um, so
Couldn't imagine. I left, and like I said, I think that was a seizure too because when I look back at it, the little frustration, panic attack feeling I had, and got
yeah,
frustrated and got up and left, that could have been a seizure. Um,
yeah,
and the whole time, I was just before it happened, I was kind of arguing with the nurses and calling them back and forth, and like, someone come talk to me, someone come tell me something. And no one came for like 30 minutes. And I'm like, I got all this time alone. How about I just walk out of here and see who notices? And no one noticed. I took the IV out. I took the arm thing off. So it was beeping. And I put the gauze on the spot where the blood was coming, and I didn't do anything for it. They make it look really easy because, like I said, I held it there and I walked all the way home. And when I finally looked at it again, it was really red. And when I took it off, the gauze was, yeah. Luckily, it had stopped bleeding, but the gauze was really red and it was time to throw it away at that time. So it isn't easy as it looks for everyone out there watching, if anybody's watching. Yeah, taking a needle out is not easy at all. It's not fun either. Angel, don't run from the hospital. They will come looking for you.
Don't put me in one.
House.
I don't want to be in one.
Yeah, when you said that, it made me think, like, what were they gonna do? Like, were the police gonna take me back to the hospital? I never thought of that till you said that, Solace. That makes a very interesting point.
Yeah.
What do you think they would have done?
I don't know. Because they couldn't have physically forced you to go back to the hospital unless you were a danger to yourself or someone else, which doesn't sound like you were.
No.
If they thought that you might be, that's the only thing I can think of. If they thought that you might have been a danger to yourself, maybe that's why they sent the police. I don't know.
Glad to make it another day. I'm here. Yeah, that's rough. And the comments on this last post, we went far from the last post. This was the one saying they were withdrawing from alcohol and benzos. And did they have a seizure? Someone said you definitely did, especially with withdrawing from benzos and alcohol. Part though, the information sucks. Yeah, definitely a seizure. I've had epilepsy since I was 13 and I'm now 19.
So they're an expert.
I'm 13 and I'm now 42.
Right. Yeah, no expert really. I do got one here though. It says anyone else has really bad memory with epilepsy. I forgot so many details and it's so frustrating, especially being in college. I can't even remember what I had for my meal. Forgot class lessons. I'm worried about my career. Anybody else can relate? Yes. Yeah, my memory is absolute. It's horrible. That's
Yeah.
I'm trying to figure out a worse word.
I used to think that, like, okay, my memory's bad, but I don't think anyone else can notice. So, but then I started dating someone, this was years ago, and I realized he noticed how bad my memory was, and he started calling me 51st dates because when we started dating, he said every time we hung out, he had to repeat the same thing every time. And that's when I was like, oh, okay, so other people notice it too. And that made me feel so bad about myself. So that sucked. Yeah.
I remember at one point, I think it was bad. It was like a year or two ago, where I was writing a journal and I had to keep that journal just to remember what happened the week before. Like now it's a little bit better, but it's not that great, you know. memory. Sometimes I get a flash. Oh yeah, I remember that from from a long time ago. And then no, I can't remember that at all. I forget people's faces. I remember I had to keep a picture of my dad uh, just to remember what he looked like.
Oh,
And it's kind of weird because everybody says I look just like him, but um, it's like I had to keep a picture of him because I couldn't remember what he looked like. I was forgetting what people's faces look like.
yeah.
In there, forgot who people were. Yeah, I forgot who my mom was one time, and yeah, she said she forgives me now. But yeah, forgot who my mom was once upon a time. That was a very funny story later on. But yeah, I do have another post though, and it says, "I'm having seizures and I don't understand them. Long story short, I was in the hospital for 2 weeks. They put me on, is it aripiprazole? ARIPIPRAZOLE. Aripiprazole. We'll just leave it at that. A few days after discharge, I had a seizure. Since May, about 4 months ago, I've had around 7. Apparently, they're violent. The first one lasted 6 minutes total, split into 3 episodes. I don't remember anything before, during, or immediately after. A total blackout. Since then, something's changed. My memory's slipping, not just names or dates, but objects, words. It's like me. It's not like me. I've always had a sharp memory. Now it's glitching and I feel it. On top of that, I've been getting random muscle jerks, arms kicking out, weird spasms deep in the body, and it happens a lot. I can't help but think it's all connected. I don't understand this. Someone who understands, explain. I don't know where to start. Angel?
It definitely is all connected. The mind, yeah, that's a tough one where to start because for me, having epilepsy for over 20 years, it's like you definitely feel that, like how we were just saying, it's getting worse. And when the seizures get worse and you're forgetting stuff and you're forgetting people, and yeah, it's all connected.
Mark, I know you're really tired, and I will see you tomorrow. Um, you can go to sleep if you'd like to. I was just saying that because you were asleep.
Oh, yes. Thank you. Yeah, dash.
Yeah, I
Past
was
my
gonna turn your
bedtime.
camera off, but he was done as soon as you looked up, and I was like, okay, well, he's done and he's awake, so let me just tell him. Yeah.
Thank you. Yes. I appreciate that. And it's good to see you. I'm glad you're back and up and running and everything. It's good to see everybody else.
You too.
Being, yeah.
Sleep well.
Glad you came back again. Good to see you again. And Angel, as always, a pleasure. Take care, everyone.
Can I ask what you're like, what made you want to start doing this?
Because there was a week where I was actually planning to do a podcast, but in California, there's so many like underground artists who do painting, who do rapping, who do DIY art. People who are just big in certain departments and they don't have the people to shout them out, I guess. I was just going to do a podcast on people who are doing things who aren't being seen in the underground, I would say. Not mainstream doing what they're doing. I was just going to do interviews on podcasts. And I was on Reddit for Grand Theft Auto for a game. And then, you know, our phones listen to us. And I seen something that said R epilepsy. It's like, what is that? Epilepsy on Reddit? I thought Reddit was just a site where you find information when you had a question. Yeah, it's been doing pretty good. I'm happy that it's helping people. And that was one of the goals, was for epilepsy awareness and then helping people. And people can look at it and actually see our real lives and see that we can actually laugh together now instead of, I don't know, just like not having anyone to talk to. A lot of people felt like they were alone for ages, just like myself. So, like I said, it helped me. And once I noticed it helping me, I was just like, helps my mental health being around people who have epilepsy 2 times a week. It's helping. And it's like, we gotta schedule this. I can't just do this every day because this is a lot. And
Yeah.
it's okay, we're gonna start doing this 2 days a week, because the first 2 days in a row, I was like, yeah, I wanted to do this yesterday because we did this. I want to do this today because we did it yesterday too. I was like, but it needs to be more scheduled and everything
Yeah.
needs to be settled. I was like, because this is really when the first time it was 6 hours, the next day it was 4 hours, and then the next day it was 8 hours. And I was like, okay, yeah, we can't just put that much time in front of this computer. But
Yeah.
I think I started
panned
on
out for the
episode
better.
4.
So
Yeah, panned out for the better.
one reason I really like what you're doing right now is because the reason I almost feel like I don't have a reason to be here because I don't have that many seizures, but I mean, epilepsy has definitely affected my life negatively. Like, I have definitely felt the stigma of epilepsy. But one reason why I think this is so cool is because, so, and please don't put this part on the podcast. But and I thought, I guess people where I live don't have a safe space to talk about their epilepsy. I just try to find places where I feel like people with epilepsy are not being heard, basically. And I just think it's really important for people with epilepsy to have a safe space to talk about their epilepsy, because I now know that, you know, there are a lot of people with epilepsy who don't have a safe space to talk about it.
There's a lot of us that didn't even know there were others like us until we came here.
Yeah.
Yeah.
And don't say that yours isn't that bad, because in a way, yeah, you know, we all have that same, I guess, mental, like, oh, it's not that bad. But then, hey, I'm on 4 different anti-seizure drugs to try to control my seizures, you know? Or you know, I've been through, like, literally, I just asked my doctor this year, but I've been through 12 anti-seizure drugs my whole life. And if you look on, what is it? The website for epilepsy. I can't remember the name right now. That's, you know, they say 2 means you're medical resistant. And I'm like, I had to ask my
Yeah.
doctor this, you know, and I've been through 12 already. And it's been happening since I was 14. And that's another thing, like me and Pookie, that was one thing we found in common when, like, you first started. It's like we were both kids when we started, our epilepsy journey, and we started on the same medicine too, Dilan. And they call it tonic clonics now, and we both still call it grand mouse.
Mm-hmm. Yeah, that's another thing. There's so much misinformation. People who don't have epilepsy, the amount of misinformation that is spread is a problem. Even people that do have epilepsy argue over, what to call it, and so I just think it's so important for there to be safe spaces for people with epilepsy to talk to each other, because
Yeah.
it's not a safe thing to talk about, unfortunately. Depending, you have to be careful.
You can come here and talk about it.
The world sees us differently.
Mm-hmm.
In one way, we're disabled, and you're not disabled enough, basically. Pookie's still fighting for, I should say me too, but, a lot of us are still fighting for disability because we can't. That's how strong the epilepsy has affected our lives. And mine's even affected my marriage, which is ended. So
more and more people join, the third person join, and eventually we're all laughing with each other because we all have something that we could relate to, and it feels like we're talking to people that we know because we all, I'm not gonna say come from the same place, but
yeah,
a lot of people feel like they have no one to talk to when they have epilepsy. But then when you have someone that you don't have to exactly explain everything to because that person already understands what you're going through, and you can laugh about how bad your memory is and stuff like that. Yeah, like Angel said, sometimes you get to know people and you feel like you've known them for a long time. And I've only known Angel since summertime, before summer. Yeah,
it was like April. Yeah.
Wait, so
yeah,
I want to
yeah.
ask you guys, for both of you, what do you think well, you've both had epilepsy since you were children. Is that what you said? Both of you?
Yep.
I've had it since I was 16. I'm 36 now. So
And I was
not
barely
since I was
14.
a child. Well, that is, I was a child. So yeah, 20 years.
Yeah.
And what about you, Angel?
I was barely 14 when my first seizure happened.
So,
What year was that?
1996 or 97, something.
so
Okay, I didn't get diagnosed for another 7 years.
what has been the hardest part about having epilepsy for both of you?
The hardest part about having it, let's see.
Or maybe what is one thing that stands out as being the most, yeah, I guess just what's the hardest? Wait, what?
The most difficult thing, it sounds like you're trying to say?
Yeah.
The difficult thing about epilepsy is it's not really bothersome to me, but I do have children. And the thing about that and my seizures have graduated from, have changed over the years. I say graduated because I was having just tonics. Well, not that I'd noticed. I was just having tonic-clonics and that was all. But I'm also having seizures where I'm wandering off and I don't know how I got there or how long I've been there, how long I've been out of it. That's the part that makes me feel bad taking my kids out. Because then I'm
Yeah.
like, I could just be at any point be looking like myself, and I could just go a bad place, and my kids would just follow me just because I'm dad, you know? And
Yeah.
that's a really scary thing to do, to be in public with your child alone. It's hard to explain. Angel, you're a father. It's hard.
Yeah.
It's really hard. I couldn't imagine where I would be like telling my kid, let's go here, and then I end up having a seizure, or I don't remember at all, or I just never come to and I'm gone, you know? So that's the only
Even
hard part
just
about that is like, yeah, like generally just having it doesn't exactly bother me, but having to keep my kids in at certain times because I'm not feeling good, or we can't go places like other people because we don't drive or we don't
Right.
do certain things. That's the only part that bothers me and bothers the kids. Is well, it doesn't
trying to
bother my
keep
kids. They
yourself
actually
safe
love
to
it.
keep them safe.
Yeah, my
Yeah.
son loves being in the house, so I don't mind that. And then my daughters, they just love everything. And
Yeah, walking
yeah,
out in the street, I don't know how many times, I like in my younger years, I would say like 20 years ago, um, trying to get to work and stuff, or, walking about, and I will end up waking up in an emergency room, and I'm like, what? What happened? You know? And,
yeah,
that was a hard part too. It's like, we have to, like, back then, we had to hide our epilepsy just so we can maintain a job.
yeah. I'm gonna have to.
And, and then we're losing our jobs because of the epilepsy. We're having seizures more than we need to because the medicines stopped working or whatever reason. But yeah, being that father part, I feel you. It's like, I don't want to take my daughter out, and my daughter's only 4, and I go out, and me and her mom just going through a divorce.
Hmm.
It's
I'm
like,
sorry to
now
hear that.
now she has to go to 2 different homes. Like, I already, and like Pookie, my seizures have changed throughout the years. At first, I thought it was only, grand mouse too. And then I come here and I'm learning other stuff, and I'm like, wow, I had those. And I had the myoclonic jerks, and I've had very long clusters with it topping at 6 hours.
Oh God.
Yeah. And they can cause problems, you know, PTSD and stuff like that.
Yeah.
Especially when, what was that one question we were talking about earlier? Have you, like, basically had a tonic clonic while you're
awake.
aware of it? Yeah, that's 6 hours of that, basically.
Hmm.
Nonstop seizure. It wasn't status epilepticus. They diagnosed it clusters, because basically my lips weren't going blue. It's just I kept going into a seizure, one right after another. And they did try things to see if I would stop seizing, and the only thing that really got it to work was Klonopin. Like I was so tired at one point that I thought maybe if I just try to go to sleep, it would stop seizing, and I couldn't even go to sleep because I was seizing still. And yeah, that's how I got onto Klonopin. And I just asked them to get me off of there because, basically my seizures are not stopping still. Like the clusters, I haven't had too much of, but they had to put me on Xcopri, and Klonopin is a bad mix.
Why do you have seizures?
So they've never been able to figure out the cause other than stress.
Okay.
That was the only
I have-
explanation I've ever been given.
Please take your medication as prescribed or whatever works for you. We're not doctors.